think AI is interesting.
Hmm.
I think you have to adapt to it because it's ever changing technology.
Hmm.
Um, I think it's good to this in the sense of we hope that it helps our nurses at the bedside in particular because it is going to help the doctors as well. And what I
Hmm.
mean is in documentation. Right now, nurses are busy. They have high ratios of patients, higher ratios than maybe they used to be. And, if you have maybe 6 patients to one nurse and you have your acuity of the patient is high or your patients are very sick, you don't have the time really at the bedside. Okay, I have to stop and document every intervention. And it causes the nurses to forget what they're supposed to document, the many areas that they have to go, depending on the EMR system, as well as what should I document? And am I going to forget it? Am I going to wait to the end of the shift where I don't remember what happened at 7 a.m.?
Hmm.
So I feel like one of the goals in our hospital system, and off, often I've heard this when I've visited our corporate offices, is the implementation of and AI, and documentation.
Hmm.
So the AI will actually document for the nurse based on what the nurse says. So I don't know what that would look like, but I think that would be helpful to have a hands-free off system where you talk into something in my head. I don't know what that looks like, but you
Hmm.
help the nurse with the thoughts in the moment that are in their head and transcribe. The other thing is we already have some AI technology in the way of staffing, building the staffing grids as well as the nurse assignments. So I think it's going to free up the activities of the nurse so they can be more hands-on with the patients and not feel rushed.
Hmm.
I think the gap of it will be some of our nurses not understanding how to use the technology. You still have an older generation of nurses that work. They were more
Hmm.
used to the old handwriting or the newer days of just typing in notes and doing things. So this will be a challenge, I think, but I think once people really recognize what it can do and wrap their heads around the technology, it will be a good thing.